Chairman Williamson, it is right at 9 o'clock. Whenever you're ready.
All right. Thank you, Lynette. Let's call our May 11th, 2023 Care Management Committee to order. I'm looking at the attendance and it looks like our board members, we have Mr. Folsom, Cynthia Rucker, and I think I saw Shane. And a few others. So we will go ahead and get started, and hopefully everyone had an opportunity to see the minutes that were sent out with our packet. And if so, I'd like to ask if we can get a motion to approve our minutes from our prior meeting, please.
Motion for approval of the minutes. This is Roger Folsom.
Do we have a second?
Second, Cynthia Rucker.
Thank you, Cynthia. So our minutes are approved, and I think we're gonna, some of the content today is a little bit of a continuation of a number of the items that our department is busy with right now. And so the minutes that we had from last meeting covered kind of where we were on a number of these topics. And at this point, Lynette, I'd like to turn it over to you to begin the general updates.
Sure, and thank you so much, and good morning, everyone. As always, thanks for the opportunity to present. So this morning, we're going to cover the end of the continuous enrollment requirements, the status of the public health emergency, and the pathways to coverage 1115 waiver. And so, as Chairman Williamson mentioned, we touched on some of these items during our February meeting, but we have actually now started moving forward with a number of these items. And so we're just going to walk through these today and share where we are in terms of the process with redeterminations, pathways to coverage, and then the end of the public health emergency. Let's see. All right. So as a starting point, I always like to just give an update on where we are in terms of enrollment trends. And so if you look at the slide before you, as of the end of March, we were at 2.8 million members. So again, here just demonstrating the enrollment trends since March of 2020. So we've increased our membership almost 700,000 by almost 700,000 individuals over the past 3 years. So now that we are starting the redeterminations, you will note that that number is going to start to decrease. So during our quarterly updates that are going to be over the next 12 months, you will notice that that 2.8 number is going to decrease. So since we've last met in May, we have actually started the redetermination cycle. So I shared with you, I'm sorry, since we met in February, I shared with you back in February that we were going to start the process in April, and we have done so. So the redeterminations began on April the 1st. Again, just as a reminder, not everyone is going to go through this process at the same time. Remember, this is going to take place over 12 to 14 months. So we are literally at the very beginning of this cycle. And as I shared with you back in February, we are going to align our Medicaid and CHIP redeterminations with SNAP and TANF renewals as well. So in those instances where we have a member, a Medicaid member who's also receiving TANF or SNAP benefits, we're going to do those renewals and redeterminations at the same time, just to streamline the process and to make it easier for the members. If you will recall, I presented this slide when we met back in February, and just resharing here again, just as a reminder to folks that this is a 12 to 14 month process, and you'll see that we will not finish until the end of May. And this is a mandate from CMS. So we must be complete. We must be complete with all of the redeterminations by the end of May of 2024. How do members complete the renewal process? Just wanted to do a quick review here of that and that process and what that looks like. So for members, they have a number of ways in which they can actually complete the renewal process. One is they can log on to the Gateway website and complete the application online. They can call in by utilizing the 1-800 number, or they can present in person at one of our local DFACS offices. And we have the link here, again, which lists the locations and the office hours for all of the DFACS offices statewide. And then finally, a member can also request a pre-populated paper form by calling in, or they can email a request for a paper form, and we will mail that out to the member. So want to touch upon the timeline, and then we're going to get into some statistics of where we are today. So renewals are taking place really in what I'd like to describe as two buckets. Bucket A are those individuals who are auto-renewed. And what that means is that we, the state of Georgia, are able to obtain information from our external resources, such as the Department of Labor, or our asset verification system, or the IRS. But we're able to pull down information from those various entities, and we can make a determination as to whether or not someone can remain eligible for the next 12 months. And so that's bucket A, that's the auto renewal bucket. And so for those who go through the auto renewal process, or for those who are able to be auto renewed, the member doesn't have to do or take any action. We will literally pull down as much information as we can to make their determination. If everything is in line and they're eligible, we will extend their coverage for another 12 months. We'll send a notice to that member, and they are literally good to go for 12 more months without any action being required on their part. The second bucket, which is bucket B, are those individuals who cannot be auto-renewed. So if we reach out and we're unable to obtain enough information to make that determination, then we will have to reach out to those members to request that they go into the system or call in and provide the requested or missing information. So for those individuals who have to go through that process, that's bucket B, the non-auto renewals, we will send those individuals a renewal notice. And so here I've outlined for you the timeline for how this is going to proceed. So since we have now started completing the redeterminations for the month of May, the first batch of notices were issued on April the 15th for those individuals who could not be approved through the auto renewal process. So those notices have already been issued. Members should have already received those. In the event that we get or receive return mail, we have a process in place to address that. And we'll be reaching out to those individuals through alternative means, such as text messaging, emails, or phone calls. But just wanted to share that the first batch of notices have already been issued for individuals who have redetermination dates in the month of May.
Hey, Lynette.
Yes.
Can I question on that? And maybe you said this, just to be clear. Can you define for us a little more the members that are eligible for auto renew versus those that are not eligible for auto renew? And maybe you
Right,
said,
so,
I didn't catch it.
yep, no, not, very good question. So for the month of May, this was our smallest group of redetermination. So we started out small. And those individuals who could be auto-renewed really were just those who we could obtain the requested information for. So it's no special criteria, Chairman. It's literally us reaching out and trying to glean as much information as we can. But sometimes, we're unable to draw down or pull down the information that we need for a member, or there may be conflicting information, meaning, we may have had information in the past that varies differently from what we're seeing today, and we need clarification from that member. And so when that happens, we'll reach out just to confirm the data.
Okay.
So no real distinguishing factors other than, can we get enough information on the particular individual?
All right.
Yep. And so just as a reminder, the earliest termination date is June, the beginning of June. So for the month of May, we're working through all of the redeterminations and renewals, and those have to be completed by the end of May. And so for those individuals who are deemed ineligible, they will be terminated at the beginning of June. Or for those individuals who do not respond or are non-responsive, they will be terminated at the beginning of June. So again, just a reminder that the earliest termination date is June for members who have a renewal date in the month of May. Want to remind everyone again about the reconsideration period. So for those individuals who do not respond, there is a 90-day reconsideration period that starts from the date of termination. So that allows individuals an opportunity to be able to send in the requested information. Once they send that information in, if we determine that they are in fact eligible, then we will make them eligible retroactive back to the date of termination so that there is no gap in coverage. So again, just really want to emphasize and remind everyone, in the event that someone does not respond, there is that 90-day redetermination period. And again, members who disagree with an adverse action do have the right to appeal that decision. So I want to talk a little bit about where we are thus far. So we kicked the process off on April the 1st, and we have completed the auto renewals for the month of May. Typically, members are auto renewed at the very beginning of the month. So we start with the auto renewals. We start reaching out to our external sources, again, to try to gather as much information as we can. And for those who can be auto renewed, they'll get a notice in the mail saying, hey, you're good to go for the next 12 months. So if you look at the first row here for the month of May, again, this was our smallest month. So the total number of individuals that went through the process or that are going through the process is 12,526 individuals. So that consists of everyone for the month of May. Of that 12,000 individuals, 5,000 of them have already been auto renewed. So that is great news. So of that 12,000, we already know that 5,000 meet the eligibility criteria, and their coverage and benefits will continue for another 12 months until they come up for the next renewal cycle. For the remaining 7,000, which is in that final, in the final column here, those individuals were issued notices. And those notices went out on April the 15th, informing the individuals that they needed to either log on to the gateway site, call in, or go to a defects office to complete the renewal process. So we are monitoring that right now. We will know at the end of May how many members have completed the renewal and redetermination process. And so we'll be sharing information regarding that moving forward. I also wanted to give you a glimpse of what the next couple of months look like in terms of the volume. So this is a common question that we're getting, which is, well, how many folks are going through the renewal process? How did you divide them up? How did you distribute the members? And so just wanted to give you a glimpse of that here. So for the month of June, if you look at that second row for the month of June, you will see that the numbers increase significantly. So for June, there will be a total of 227,000 individuals going through the redetermination process in June. And so we are now already conducting auto renewals for individuals for the month of June. So we start this process 45 days in advance, so well in advance of the end of the month. So when we meet again, we'll have the numbers for the month of June in terms of who was auto renewed versus who had to go in and actually complete the process. So for June, for those individuals who are not auto renewed, they will also receive a notice. So it's the same process that we will follow for the next 12 months. So we'll either auto renew, and if we can't auto renew the individual, they will receive a notice in the mail instructing them to go in and to actively participate in the process and to provide the requested information.
Okay, can I ask just another question there, Lynette, and
Yes.
then pause and see if anyone else has any questions. So for example, with May, and again, these numbers get much bigger in June.
Yeah.
In May, the 7,374 who are not reviewed, so they have to, do something, to kind of, clarify communication, go into one of the offices, et cetera. But if, let's say, none of them do that, then those 7,374 currently enrolled will cease to be enrolled effective when?
June 1st. That's correct. June 1st.
June 1st. Okay.
Correct.
So they need to get it done in May or as of June 1st. A little more than half of May's total group will cease to have benefits.
That is correct. And so I'll add some context here. I think that's an excellent question. So as it relates to the 7,000 who we've issued notice to, one thing that I want to talk about, and again, I think your question warrants some additional explanation here. So let's say that we issue the notices and we receive some back in return mail. We know that that's going to happen. It's going to happen nationwide, right? Where we issue notices or other states issue notices. The member may have moved and did not update their contact information. And so that notice may come back. Well, the good news is we have a process to address return mail. And the first thing that I want to mention is all return mail is coming back to one centralized location. And so that's a change from how return mail was handled in the past, where it went to each individual DFACS office. Now it's all coming back to one centralized location. What we've also done to assist with the process is that on the front of the envelope, on the front of each envelope that's mailed out, there is a QR code. And so if that notice comes back to the state, then we will scan that QR code that is tied to that specific member. That member's name will then be placed on a file, and it will alert DFACS that the notice was returned and that we need to reach out to that member through other modalities, whether that's email, text message, or call. And so we will take the opportunity to reach out in those other manners, those other ways, to inform that member that, hey, we received return mail from you. And number two, we are encouraging them again and reminding them to go in and to complete the renewal process. So it's important that folks are aware of that, because we do know that we are going to get return mail, but we have a process in place that will allow us to, number one, be informed of when that mail comes back, and then again, presents the opportunity for additional outreach. The other thing I'll mention there is that we are working very closely with our care management organizations. And so they're going to be doing outreach as well to all of the members that are enrolled with each individual plan. So they're going to do text messaging campaigns, phone calls, direct outreach, emails, and just some non-legal notices as well. So the care management organizations are reaching out. And then finally, I'll mention, we have started working with some of our large hospital systems. So CHOA, just to name one, Northeast Georgia Center, to do additional outreach as well. So I'll share some of what CHOA is doing, which I really thought was a great idea. Number one, they have started handing out materials, flyers, and pamphlets in their ED when members present, informing them about the redetermination process. And they have also added verbiage to the after visit summary. So once a member is discharged from their facility and they get the after visit summary, informing them of what they should do, at home, there's verbiage there to remind the members about the redetermination process. And so Northeast Georgia Medical Center is going to take some similar approaches, and also text messaging and outreach as well. So we're just making our ways and working through, and talking to all of the largest hospital systems that have the largest amount of Medicaid members that they serve and submit the largest number of claims to get their assistance as well. So I hope that gives some additional context, because, for that 7,000, to your point, Chairman, we've got to make sure that we are reaching them and that we're informing them to go in and complete the process.
I appreciate that additional information. And so there's a lot of, obviously a lot of effort being made to try to connect with folks. And I just want to pause to see if any of our other board members might have any questions about this at this time.
I do have a question, Ms. Rose. I agree, the outreach is great. It is definitely great to hear about all the outreach, and also the website. I went on the website that you all have, and I think it's great. The information is all in different languages, and there's all sorts of flyers. So I think that's great. I just had one question, and you may have answered it. I'm not sure. But for those who have to manually confirm, like that 7,000 group, and I can imagine the group for June, and it'll get larger and larger. So do y'all have like a whole group of folks that are doing all the manual? Because that's probably going to be really time consuming for y'all.
Yeah, great question. And so we implemented, or I should say DFACS implemented some new technology several months ago, maybe about a year ago now, in preparation for this renewal process. It's called the bots. And so the bots are actually doing a lot of the work now, so that you don't necessarily need a caseworker, to touch every single file. So the way it works is the bots are doing a lot of the data entry, so that you don't need a person doing data entry. The technology is handling that. And then the caseworker is reviewing and approving the case. So that helps to move the process along much faster. But you still need individuals to, review and approve the final cases. So DFACS has been working consistently to interview and increase their staffing and train staff. So they've been doing that for several months now. and are continuing to hire and staff up as needed.
That's great. Thank you.
Yep.
Great question. Thank you, Cynthia. Any other questions? All right, Lynette, we'll continue.
Okay, and so just to close before I move to the next page. So we have a distribution for the next 12 months of the numbers of members that are going to go through the process in the various groupings. So just wanted you all to be aware that, you know, there is a method to how we're proceeding with this process. But if you have any other questions, just let me know. We can share that information. So here, this just further outlines what I've already discussed. I'm not going to spend a whole lot of time here, but again, for those who cannot be auto-renewed, this is the process for how those notices are going to be issued. So for using the month of May as an example, first notice went out on April 15th. If we do not hear from those members or we don't see where they've gone in to attempt to complete the process, a second renewal notice or a reminder notice is sent out to members to say to them, hey, we've not heard from you. Want to make sure that this is on your radar and that you complete the process. They'll have a verification checklist that will identify the data that is needed. And then at the end of the month, at the end of every single month, we will send out a notice of decision or a closure notice. So for individuals in the month of May, May 31st, they'll get a notice that'll either tell them you're approved or your case is closed and you're terminated. And then if you look at that last final box here again, the reconsideration period that I mentioned earlier for those who are non-responsive. Also just want to mention pathways, right? Because I don't want folks to forget about the pathways to coverage waiver. So there is an intersection between the end of the continuous enrollment requirements and the pathways demonstration waiver. So as a reminder, pathways is scheduled to go live on July the 1st. So literally just in a couple of months. And this waiver is designed to provide coverage to individuals ages 19 to 64, again, with incomes up to 100% FPL. The individuals must meet the qualifying activities and they must opt in, which means they have to apply for the program. So I mentioned this previously, but we've taken a look to try to identify those individuals who we think would qualify for pathways based upon the information that we have. And for those individuals, chairman, and for the members of the board or the committee, we have delayed their redetermination date until after the July 1 go live date. And so that was to prevent those individuals from being terminated and to allow them the opportunity to opt in or apply for pathways after the program goes live on July 1. So just wanted to remind you here about the qualifying activities. So remember, you have to complete at least 80 hours a month of qualifying activities, and you have to meet the criteria at application. So when you apply, you have to be able to demonstrate that you're already meeting that 80-hour a month qualifying activities component. And then the individual is required to report out each month that they're continuing to meet the requirements. And so I just listed for you here again as a reminder what the qualifying activities are. So again, the individual can be employed, including self-employment. On the job training is also a qualifying activity, community service, vocational education, enrollment in an institution of higher education, and participation with Georgia Vocational Rehabilitation Agency. So those are the qualifying activities that can assist in helping someone to meet the criteria. So want to just shift to talk about some of the provider considerations. So as a part of our outreach and educational efforts, we have spoken to a few of the provider associations. We did a webinar with the Georgia Hospital Association. We did a webinar this week with the Georgia Healthcare Association. I think in the month of June, we're going to try to schedule something for the Georgia Academy of Pediatrics. And then we actually traveled down to a meeting with Hometown Health to do a presentation as well to some of the rural hospital providers. And we're presenting out to all of these associations on the redetermination process and the unwinding of the PHE. So again, I just want to say publicly, if there are any other associations that would like for us to do webinars, we're available to do so. We've tried to record and post all of those in various locations. So I think the one with GHA is posted on the GAMAS website, so individuals can go out and review that. I do know the Georgia Healthcare Association posted theirs as well on their website. And I believe the one at Hometown Health was recorded as well. So individuals can go back and review those later. But it's important that we communicate what's happening out with the providers, because this impacts them as well. This doesn't just impact members, it also touches the providers. And so what we've tried to emphasize is that providers have to verify eligibility on the date of service. Over the past 3 years, folks have gotten a little lax about doing that because they knew that we were not terminating any members and members were staying on the rolls and the rosters. But now that we are terminating members or moving through the redetermination process, it is imperative that providers verify eligibility. And we also just want to remind folks that you have to verify eligibility even if you received prior approval to render services. So the fact that you've gotten prior approval does not negate, the necessity to verify eligibility. And again, if the member is not eligible on the date of service, that provider will not be reimbursed. We've listed here the ways in which providers can verify eligibility, and we've shared this with the associations that we've presented to thus far. They can call in, they can log online on the GAMAS website and portal to verify eligibility, or submit an electronic request through their clearinghouse. So these are, again, just the ways in which an individual or provider can verify eligibility. And I'll mention this here because this is something that we're working on that is going to be very helpful. And this was a request from some of the providers out in the community. We are going to add a page onto the GAMAS site that will allow a provider to go in and update contact information for a member. And so this was very important, I think will be very helpful for those instances where a member is presenting to a physician's office or a hospital. That hospital or that practitioner's office can actually log into the GAMAS site and update that member's contact information while they are there on site. So this is something new. We don't do this today. The folks over at Gainwell Technologies are programming this functionality right now. So this is slated to be stood up in the very near future and will be very helpful as we go through this process. Again, in terms of the communication plan, I think you guys are already familiar with the websites. And thank you, Ms. Rucker, for your comments there about the staycovered.georgia.gov site and the DHS website. We're trying to make sure that we update those as we get new information. But again, just a reminder for folks to log on to those websites to see what's there. They can print down materials from those sites to share with their practices, which will be very helpful. And again, as a reminder, just to check the banner messages to stay abreast of what's occurring. So how can providers help? Again, notifying your patients and our Medicaid and Peach Care for Kids members that redeterminations begin on April 1st. And again, however the provider chooses to do that, we're in support of, whether that's text messaging, printing down pamphlets and flyers, doing what CHOA is doing, which is adding verbiage to their after visit summaries. All of that's helpful. And just reminding folks to update their contact information. So want to talk a little bit about the public health emergency, because this is also very, very critical. So as a reminder, today is the last day of the public health emergency. It ends on May the 11th. So we've tried to, again, emphasize this in all of our presentations to our provider associations so that folks are aware of what's occurring. Some of those waivers and flexibilities, are going to automatically end. Commissioner Noggle is going to talk about that in more detail at the start of the board meeting today at 10:30. So she'll give more updates and details information on the public health emergency. But just as a preview, these are some of the flexibilities that are going to be impacted. So provider revalidation. Providers will be required to go in and revalidate their enrollment. So that's been on hold since the public health emergency. We've tried to encourage providers to go ahead and complete that process and get it done. But now it is going to become, once again, a mandatory requirement, and that's because of federal regulation. Site visits are going to resume. We've talked about that. All prior authorization requirements will resume. So as you guys are aware, we put a number of the prior authorization requirements on hold, but those are going to resume moving forward starting tomorrow. And then just a few other things I've noted here: application fees and the provision of services in alternative settings will end. So again, Chairman, Commissioner Noggle will touch upon this at the board meeting today, but just wanted to give you guys a preview and to remind the committee members that today is the last day of the public health emergency. So I'm going to pause there to see if there are any questions from the committee members.
Thank you, Lynette. So a lot of really good information. So are there any additional questions either about the re-enrollment, which we've got a lot of detail on that, or the ending of the PHE?
Lynette, this is Roger Folsom. I just want to thank you for an incredibly and extraordinarily great explanation of all this. This is very helpful. Thank you.
Thank you, and we'll continue to keep you all posted as we progress, through the next 12 to 14 months. It's been a lot of work that's gone into preparing for this, and it's not just work on our end. We've gotten the support and collaboration from the providers. Again, the Georgia Hospital Association and all of its members are in support and on board. The various associations, Georgia Academy of Pediatrics, Academy of Family Physicians, a number of other entities. So it's a village effort. It's a village effort. But thank you for the compliment, and we'll continue to keep you posted.
Any other questions or comments?
I just want to comment, this is an excellent update. I agree. And you spelled it out really well. And it just feels good to see all the work that's being done and what's happening related to the redetermination. So yeah, well done.
All right. So Chairman, that concludes my presentation today. I will turn it back over to you for any new business.
Well, again, very, very comprehensive. I think we feel very well informed, and we know there are a number of websites and other places where we can get, additional information or see further detail if we would like. At this point, I'd like to ask our members if there's any new business that we would like to discuss, or any other closing comments? One question that I have for our members, if there are there any particular subjects, you know, around the care management area that you would like us to perhaps consider for further review at subsequent meetings? And if none come to mind now, you know, understand completely, but if you have some thoughts or ideas on what you may want to continue to look at, or things that we might want to ask for more information on, or further understand, just please reach out to me or Lynette, and we can look at, you know, how to get all of that information communicated to us. So if there are no further comments, and Lynette has done a great job as always informing us, we will close the meeting, and we will see everyone at 10.
Thank you. Have a great day.
Thank you, Lynette.
you.
Thank you.